Okay, well, good morning. Let's share my screen here.
I'm realizing, I apologize. I'm realizing I did not give you all the opportunity to introduce yourself. So, Curt, why don't you go ahead and do that? And then, Carolyn, when we come to your presentation, we'll have you introduce yourself from there, and we'll go on down that route.
Oh, can you see my screen?
It says that you started sharing your screen, but I'm not seeing your presentation yet.
Oh, Zoom quit unexpectedly. Oh.
Uh-oh. Okay. Well, why don't we give you time to take care of that?
Manager with the Orange County Healthcare Agency. Been with the agency for going on 25 years. I'm getting this error message saying that Zoom quit unexpectedly again.
Okay. Okay. I do see your presentation now.
Okay, good.
Okay. And see, maybe as you go through, we'll see if it continues to give us issues. If so, maybe we'll switch over to Carolyn and then go from there. But I am seeing your presentation.
Okay, good. So, so my group has over the years used the birth, the death, hospitalization, emergency department data to track various health trends, including drug and alcohol morbidity and mortality. And so we've got actually a couple of reports that are coming out. We actually have one report that's already out with respect to drug and alcohol morbidity among youth and young adults. That's on our website. And our website's at the bottom there. It's OCHealthinfo.com /publications. And then we should be releasing, hopefully next week or two, a trends report from 2009 to 2020 regarding drug and alcohol morbidity mortality with respect to emergency department visits, hospitalizations, and deaths. And along with that is a new interactive dashboard that will hopefully launch next week also. So as you all know, September, this is the last day of September, was National Recovery Month. And as David mentioned, also suicide prevention. And so the agency's had a lot of activities this past month, helping promote recovery and reduce stigma and encourage, hope through treatment and education. So just to kind of provide a little context, this figure summarizes the overall mortality rate in Orange County from 2017 through 2021. And as you'll note, over the last 5 years, in 2017, 18, and 19, the mortality rate in Orange County was relatively level, relatively flat, about 20,000 deaths per year in Orange County. That the numbers of deaths are shown with the blue bars, and then on the left axis, and then the corresponding rate in the red line in the y-axis. And as you'll note, in 2020, the first year of the pandemic, the number of deaths increased pretty markedly, and then again in 2021, and primarily due to COVID. Upwards of 7,000 people in Orange County have died during the pandemic from COVID. But also, we've noticed, during the pandemic times, we've seen an increase in drug and alcohol morbidity and mortality. And just to kind of provide a summary, in 2021, the leading causes of death in Orange County for nearly 25,000 deaths, still heart diseases, cancer are the two leading causes of death, followed by, COVID came on strong in 20, and then in 2021, where we had almost 3,500 people die from COVID. And accidental drug overdoses would be captured in accidents or unintentional injuries, the number 5 leading cause of death. So this includes car crashes, accidental drug overdoses. And interestingly, though, suicide is not in the top 10 or 11 causes of death in Orange County. So for the overall population. So that's the good news, is that suicide has dropped out of the top 10. But we're tracking suicide rate trends in Orange County and California and the US. And as you'll note, Orange County is in kind of the orange line. It's kind of increased slowly over the years from back as far as 2000. Orange County's mortality or suicide death rate increased about 18% since 2001. And it's about 2% in the last decade, since 2011. Compared to California, which is the red line, California tends to have a slightly higher suicide rate. And the blue line is the US suicide rate, and which is higher. And both the state and the nation's suicide rates have increased, kind of systematically over the past 20 years. Just to provide just kind of a sense of what these numbers mean, in the US in 2020, there were about almost 46,000 deaths due to suicide. In California, about 4,100. And in Orange County in 2020, 288 suicide deaths in 2020 and 339 in 2021. So Orange County suicide rate is, remained relatively, it's more variable than the state of the nation given the small numbers. But it hasn't increased markedly during the pandemic as we might have suspected. And then in terms of emergency department visits over time, the blue bars here represent the number of ED visits to Orange County residents, and then the orange line is the age-adjusted rate. And you kind of notice a declining trend over time, which is kind of counterintuitive to what we hear, anecdotally and in the media about, the increase in mental health issues, especially during the pandemic. But we know certainly during the pandemic in 2020, access to emergency department care for anything that's not related to COVID was greatly, interrupted. People didn't want to go to the emergency department during the pandemic just for fear of, being exposed, and the emergency departments were often, making it challenging to get in to be seen. They were dealing with so many COVID patients. So this is somewhat counterintuitive also in that, the emergency department visits seem to have a declining trend over the past 15 years or so. That's not to say that people aren't still, suffering from mental health issues or anxieties or distress, but they're not necessarily showing up in the emergency room. So then just to transition over to the main topic today is in terms of drug and alcohol morbidity and mortality in Orange County specifically. But here we just kind of compare, in the United States in 2021, there was over 107,000 deaths due to drug overdoses, and over 71,000 of those involve fentanyl or some other synthetic opioid, which suggests there's typically synthetic, meaning man-made, and also possibly illicit. And then over the past 20 some years, there's been like 3 waves in the opioid crisis. The first wave was primarily driven by prescription opioid overdose deaths. Physicians, dentists were offering, pain medication, and the pharmaceutical companies were encouraging, the wide distribution of opioid medications to treat legitimate pain in people with like terminal illnesses. But then it grew into a problem bigger than some unintended consequences, I suppose. And then the second wave came in around 2010, when restrictions were put on opioid prescribing practices, and the Department of Justice started tracking narcotics prescriptions and going after physicians that were in pill mills, and physicians who were prescribing for profit, selling drugs on the side. And then now the third wave, I guess, started around 2013, was a rise in the synthetic opioids. And I think it was more out in the East Coast early on, with more powdered heroin. In the West Coast, I think we tended to see more the heroin, the tar balls, that were harder to cut with other substances. And so we didn't really see a lot of fentanyl in the West Coast and Orange County until more recently. So in in 2020, California saw a 1,500% increase in deaths related to fentanyl, which is just, mind-boggling that we went from 239 fentanyl-related deaths in California to almost 4,000 4 years later. So fentanyl definitely, it landed in Orange County in California, and coincidentally during the first year of the pandemic. And so here we show trends in drug and alcohol related deaths in Orange County over the past 10 years. And as you'll note, so the bars indicate the numbers of deaths to Orange County residents, and the red line is the rate. So the rate of drug and alcohol related deaths in Orange County is systematically increased about 3.5% each year since 2010 up until 2019, just before the pandemic. And then however, during the first year of the pandemic in 2020, the rate increased by 33% and another 30% between 2020 and 2021. So all told, the drug and alcohol mortality rate in Orange County more than doubled since 2010. It's a 127% increase. And so these figures are from our dashboard that's going to be launching hopefully this week or early next week. And so here we summarize, we separate drug and alcohol related deaths. So you can see that both have increased systematically in the past decade, but the big increase was to drug related deaths in Orange County during the pandemic. Specifically in 2020, 2021, the blue bars, you see the big increase in the number of drug-related deaths to Orange County residents. And on the right panel, it's the corresponding rates. So alcohol-related deaths, show this more gradual, but pretty consistent increase over time, which those alcohol-related deaths are typically related to more chronic conditions like cirrhosis of the liver. And so you don't typically die immediately from that. It's something that develops over, months and years. But the alcohol-related deaths nonetheless have increased 62% since 2010. Drug-related deaths have also increased each year, but in 2020, the rate shot up by 58% in 1 year and more than doubled in 2021. So that's a pretty stark and it's kind of a scary development for Orange County. I mean, clearly during the pandemic, people are, using drugs and alcohol to help cope and perhaps self-medicate. I mean, I know during the pandemic, especially in the first year, I mean, a lot of my friends and family are sharing their recipes for different types of cocktails on social media. So alcohol use is definitely up across the board, and it's obviously contributed to increase in liver disease and other issues. And then drugs also have landed and hit hard during the pandemic in Orange County. So if you'd separate the mortality, drug and alcohol related mortality by gender or sex, males have consistently had a higher rate of alcohol and drug related mortality. But in 2020, males shot up 42%, females shot up 11% during the first year of the pandemic. And then in the second year, males increased another 20%, 7%. But interestingly, females had a slightly even bigger increase of 38% in 2021. So all told, females have had a 91% increase since 2020, and males have had a 145% increase. It's a 2.5 time increase in alcohol and drug related mortality. So this is I apologize for putting such a big and ugly table up here, but this is just the number of alcohol-related deaths, drug and alcohol-related deaths by age group over the last 5 years. And I want to point out that, in 2017 through 2019, you don't see very many drug or alcohol-related deaths to teenagers in Orange County. We have 1 or 0 cases. And then in 2020, we see, 9 kids died from a drug alcohol overdose. And then in 2020, we had 20 deaths. So those are pretty, you go from 0 or 1 to having 9, 10, 9, and then 20 is pretty startling and eye-opening. And other age groups have similarly shown increases. Young adults, 18 to 24, showed a big increase from 2019 to 2020. 18 to 24-year-olds had 150% increase. And all the age groups except for the oldest folks, 75 to 84-year-olds, 85 and up, showed no increases or some decreases during this time. So if you look at the types of substances that were on board when someone died, the lime green bars are number of deaths during a 3-year period, 3-year average number. And then the 2020 cases are in the dark blue, and then 2021 are in the orange. And you'll note you see big increases in any alcohol related deaths, but big increases in opioid related deaths, up to 746 deaths in 2021 that involved an opioid. And often, when people do overdose, there's many substances involved. They're not just using one in isolation. There's often, alcohol's typically involved, as are, with opioids, people are also using benzodiazepines possibly, or cocaine or methamphetamine. But you'll see here just the stark increase in the number of opioid related deaths that's occurred during the pandemic, as well as other things like stimulants other than cocaine, which would be primarily methamphetamine. And then this figure just basically breaks down the types of substances that were involved in overdose deaths to teenagers 10 to 17 and then young adults. And the same thing, the lime green are the pre-pandemic 3-year average number of deaths. So like for 10 to 17-year-olds in the pre-pandemic period, we had very few opioid related deaths, thankfully. But then in 2020, we see 7 and then 19 deaths to teenagers in 2021. And similarly with young adults, 18 to 24, we were seeing opioid related deaths, 35 pre-pandemic, and then up 76 and 80 during the pandemic. So the opioids, as I'll describe soon, is that these are primarily driven by fentanyl. And so fentanyl, as I'm sure many of you are aware, is now the #1 killer in the US for 18 to 45-year-old people. Fentanyl is 50 times more potent than morphine and 100 times more potent than heroin. And it's a man-made synthetic drug that can be mixed in with other street drugs like heroin, ecstasy, meth, cocaine to increase their potency. And often people are overdosing unwittingly, not knowing that the drugs that they've obtained are laced with fentanyl. And then fentanyl is also being pressed into pills. And more recently, we're hearing in the media and in law enforcement that they're pressing them into pills and coloring them to make them presumably more attractive to young adults and teenagers, perhaps. The rainbow fentanyl is showing up. And so it's basically suggesting that the drug dealers are trying to target a younger crowd. So in terms of the fentanyl related deaths in Orange County to Orange County youth and adults, we have a 550% increase in fentanyl involved overdoses between 2017 and 2021. And the rate of fentanyl involved overdoses rose 8.5 times within this 5-year time period. And so it's definitely, you need to let your kids and your family, your kids know that they need to be really careful. That there's a lot of illicit fentanyl laced drugs out there, things that you might have used in the past, like marijuana, cocaine, or other things are being adulterated with fentanyl. And so again, apologize for this big table, just want to show you kind of a quick summary of the number of fentanyl related deaths. In 2015, we had a total of 18, and it's increased each year, but then in 2020, it jumped up to 383. And then in 2021, we had 639 fentanyl involved deaths. And again, it's affecting all age groups, but it's especially hitting hard, for the younger adults and teenagers who've historically have had not had many overdose deaths. And then in terms of the percentage of fentanyl involved opioid related deaths, overdose deaths among youth and young adults, back in 2017, about 30% of any opioid related death involved fentanyl. And it's increased every year up to almost every fentanyl related death in Orange County in 2021, 98% involved fentanyl. And so as many of you are probably aware, if folks are going to use illicit drugs, they really should test for fentanyl is one way to protect yourself, to know what you're using. So you might think you're using a sedative or a tranquilizer, but you can test to see if there's fentanyl in the mix, so you can hopefully prevent an accidental overdose or death. And then also the healthcare agency with our partners and in the community are working to promote the wider distribution of naloxone. Narcan is it's an opioid antagonist that I'm sure you all know that can reverse the effects of an opioid overdose. And naloxone can be obtained free at a local pharmacy. So you can go to a CVS or Rite Aid pharmacy and ask for some Narcan, and just to have it, in case you happen upon someone who has overdosed from an opioid substance. And then just to kind of these links won't work obviously in a Zoom presentation, but we can make these slides available to you, the links to different resources that we have, including which I'm sure Carolyn's going to talk about too, some of the efforts that we have at the healthcare agency with our partners to promote awareness education. And then also we've just launched this OC Navigator, which is supposed to be basically a web page that makes it easier to find the help that you need. And so if you go to this website, you can look for help with respect to substance abuse, mental health, housing, legal aid. And so hopefully it's a resource that will become available, or people will become more aware of and use it to get the help that they need. Okay, that's what I have. And if I don't know if we're going to do questions now or at the end.
Well, thank you. First off, thank you, Curt. That was really valuable, really insightful. I'm going to share the link to the report in the chat. Now, what's the relationship between the report and your PowerPoint summary of the report?
Yeah, a lot of the slides were just copied from our dashboard and reports that are coming out hopefully next week.
Great. Well, thank you. We'll hold off on questions for now, and see about making time available at the end.
Okay.
To keep things moving, but we appreciate it. I think just maybe a quick comment. We use the language sometimes for those who are in the mental health and substance use prevention and substance use treatment field. We talk about the idea of deaths of despair, particularly around things like suicide and overdose. And so in many ways it's fitting language, because obviously for both those who die by suicide and those who die by overdose, there is some deep psychic pain underneath what's happening for them, that leads to feeling like there are very limited opportunities or very limited options for coping and managing that pain. And so a big part of approaching that, of course, is finding ways to open up pathways of hope for those who are dealing with such pain and such despair.
That's true. Yeah, I failed to mention that too, in terms of, with the suicide rate in Orange County being counterintuitively, flat the last couple of years, especially during the pandemic, was somewhat counterintuitive to what, we're sensing in anecdotally. And that, so my thinking is that, if someone overdoses, it could be unintentional, or like you said, it's an issue of despair. People have given up. And so those accidental overdoses may not be so accidental, but it's, it's without, without a note or some other signs, it's not, the coroner can't determine if it was so the default is it's accidental. But I suspect that many of those overdose deaths were due to disease of despair, and so could, would contribute to the suicide rate. So I think that the suicide rate being flat or level during the past 3 years is probably not very accurate reality.
Hmm. Hmm. That's really important insight. Thank you. So as we shift and introduce to you all Carolyn and in her presenting on life is greater than drugs and some of the work of the ADEPT team. I think that's saying two things twice, but same thing twice, calling it the ADEPT team, but the alcohol drug education and prevention team. But as we introduce Carolyn, I'd love to have you introduce a little bit more about yourself. We'll get your presentation up and going. But this, I want to invite you all to consider this as part of that transition from, becoming aware of some of the issues through Curt's presentation, and now considering some of the ways we might look at building some of those pathways of hope. So Carolyn, let's introduce yourself and we'll go from there. Oh, you're on mute.
Good morning. Good morning. Carolyn Secrist. I too work for the Orange County Healthcare Agency and excited to follow up with on the stats and the data that Curt has presented because the healthcare agency has taken the initiative to address these issues, especially among our young people. So I'm hoping you'll be able to see my screen. David, is it up?
It's up. We're still seeing the card view. We're seeing all of your different slide cards. So it's not in presenter mode, slideshow mode yet.
Gotcha. Okay. And bear with me, my technology, even though we've been doing it for years, is not polished. Okay, how's that?
Great.
Okay. So a few years back, the healthcare agency, the alcohol drug education prevention team in which I get to work, we worked with a professional media vendor, Pulsar, to help us develop, design, and then implement a campaign, Life is Greater Than Drugs, geared specifically for our young people. And our goals included, obviously, to prevent misuse of prescription drugs, and similar to what Curt was talking about, youth perhaps not knowing the drugs that they were getting their hands on, whether it be through social media or on the street or by a friend, being laced with fentanyl, as well as the danger of just misusing prescription drugs. We also look to increase the awareness and then, of course, ultimately decrease the rate of those young people that take the California Healthy Kids Survey. Some of you may be familiar with that. We look to gauge our efforts and help measure the outcomes that we're able to reach. Because it was youth focused, of course, everything was digital and social. We didn't do any of the print ads or anything like that, because you all know, working with young people, they are glued to the phone. So we utilize the Facebook, Instagram, Snapchat, TikTok, all the ones that are popular, to do what we call paid advertisements. And so these ads were served to the population in which we were trying to engage and educate, and that's the 13 to 18-year-old mark. And that means that probably most of us here on this call did not get one of these ads. Perhaps you did. I don't want to assume the youngness. I did not receive any. I can put it out that way. So the good thing is I get to share a couple of those ads with you, 15 seconds, because research tells us that the attention span of young people is not much greater than about 8 seconds. So again, something short, catchy, and creating awareness. We took the campaign in a positive approach, and we are trying to get the message across to our young people that there's all sorts of great positive things to do to help you reach your goals in life and in school, wherever, whatever goal you may be working to achieve. They're short and eye-catchy, as I mentioned, and they've been designed where it's to look like someone in that age group has uploaded their own video and kind of showed the world what they can do in terms of being proud of their skills. So we have a video on a young person doing the drums. He really rocks out. We've got a surfer, we've got a singer, and then we've got 2 young people just kind of hanging out and having some fun, laughing with some ice cream. On those videos, however, there's superimposed some messaging that speaks to the young people about misusing prescription drugs, opioids, things like that. Now, I'm going to give this a shot. Bear with me. So we are entering the website. Again, we're working on getting the videos, a click button that one can see the videos. But when an ad is served up to a young people and they click on it and they watch the 15-second shot, it encourages them to click onto a website. And this website, I can put the link in the chat. It's very short and brief, again, knowing the attention span, to help create awareness and educate young people about alternatives for them to do. So I'm going to scroll down pretty quickly, but it has a couple sections about the facts and the data. It tells young people what are prescription opioids, what's going on, what's the problem, why they're dangerous if they're not prescribed to you. And this is the fun part of the website, because when a young person clicks, or anyone clicks, it gives you ideas of things to do and also resources of where you can go for hikes or where you can look at art and do things. So it's hopefully a one-stop shop, if you will, as young people get through the website. Of course, we have resources for getting help. And then one of our asks of the young people has been to share it, because they're big into that liking and sharing stuff. So I know it's not friendly, it's at the bottom, we're working on that. But let me just show you a video or two if you're interested.
So Carolyn, on our end, we're still seeing the PowerPoint presentation.
Oh, tell me. Oh, I've got to unshare and reshare. Is that right? You
That's
told me
right.
that, and I've already forgotten it. Okay, stop share, and then I'm going to share. Okay, and I've got it on full blast, so hopefully it won't do your ears. Does anyone want to see another one?
Yeah,
All right.
I do.
Okay. I'll show you one that got very high ratings according to our analytics. And that was this young person showing off his soccer skills, which was very interesting for us. Okay, I have to share. Bear with me, my technical skills are not grand. Are you able to see my screen with the,
Yeah, we see it. There we go. We see him.
I can watch him forever. It's amazing what he can do.
Yeah, both of those people, both those when people in those videos have some skills.
Yes,
That's
and
insane.
it's really to showcase, right, what our young people can do
Yeah.
other than. Do
Mm.
we have time for another 15-second one?
Sure.
All right, how are we doing on time here?
Can you hold the video?
But now I want ice cream.
Yeah, well, that was the problem with that one. We all went out for ice cream afterwards. Okay, are you seeing the PowerPoint again?
Yes.
Phew. All right. I don't like the way this is looking. Oops. Well, here we go. Okay, can you see the next slide? It's got the feet of the surfer.
Yes.
Yeah, so again, this is just an example of this the social media post that we did. And then we also came up with some messaging down at the bottom again to remind them your life is greater than drugs, you are greater than drugs, be stoked, things like that. Don't mess up your melody by misusing painkillers, just keep singing. So trying to get clever for the young people so they would click on the ad. Killer waves is greater than misusing drugs. So behind the scenes, you know, I would be remiss by saying it did not take us a long time to get this from start to finish out the door. But part of the reason is, of course, we did some extensive research on what the data said, the areas, the age groups, things of that sort. We did a large amount of focus group testing with young people, with parents, with families, with key decision makers in the field, experts, things like that, to really help guide what messaging would be the most influential. We actually ran that campaign 2 times. We launched it in October of last year and went a few months. And then we took a break from it and then capitalized in April by releasing it again around the prom time and the graduation time, getting ready for summertime, all that stuff that sometimes young people are maybe socializing or partying a little bit more. So hence the reason for the second time frame. That's the campaign in a nutshell. We are still promoting it, even though we're not using paid advertisement. Anytime we go out in the community, we are encouraging our young people to get onto the website. The website is still live. and seeing the alternatives they can do and to share the videos and all that good stuff. So thank you for listening.
Carolyn, thank you. It was great. This approach, I think, is a really important one in terms of what we were talking about earlier about creating pathways for hope. You know, often in the mental health world, we talk a lot about the value of coping strategies, the value of self-care. And we, at times, I think, I don't know, inadvertently, this image, I think, arrives in people's minds that coping strategies or self-care are often about managing the symptoms or experience of things like anxiety or depression. And certainly they can be supportive in terms of that. But at the grander view is that coping strategies are really about helping people uncover the things in life that give them a sense of meaning, a sense of enjoyment, a sense of connection, right? Which produces hope when someone is struggling, because they're aware of places in their life where there is meaning and connection and enjoyment. And so the idea of really just tapping into what are people's passions, what are young people engaging in that they really love and enjoy, and highlighting that substance use creates a serious risk to damaging one's capacity to do that, certainly even in an ultimate sense if use turns deadly. So I think it's a really brilliant approach, and something that we can maybe, as we're working with young people, continue to think creatively about how do we encounter them around the things they're passionate about in which they find meaning.
Exactly. Well said, and really the basis of taking a positive approach.
Yeah.
And more of an asset versus a deficit.
That's right. That's right. Countering risk factors with protective factors, to use our terminology. Well, Carolyn, thank you. I really appreciate it. We really appreciate it. I do want to switch now and really begin our conversation with Leslie. Hi, Leslie. Why don't you take a moment, if you're open to it, to introduce yourself to the group, and then we'll start our conversation.
Hi, everyone. My name is Leslie. I'm currently a student at Cal State Fullerton, and I'm very excited to talk about mental health and also my experience with suicide.
Thank you, Leslie. And for those of you who received the Connect OC newsletter, have been following kind of our monthly updates or bi-monthly updates, Leslie was our most recent Young Adult Spotlight interview for our September-October newsletter. So Leslie, why don't we start off, if you would, share with us a bit of your story in your mental health journey.
My mental health journey started at a very young age, at 7 years old. I was diagnosed with anxiety and started going to therapy due to selective mutism. I came from an emotional abusive household, which played a big role in my mental health and how much I struggled, where I came from a Hispanic household where, you know, like mental health is very not like discussed and something very difficult to understand. I was later on diagnosed with OCD as well. And that was very difficult because I felt like I had to hide it from my parents, just because, you know, I felt like I was already bugging them with my anxiety. I switched around a lot with different therapists, so that mental health like journey aspect was very difficult for me. Eventually, when I did turn 18, I was finally able to, you know, get my own therapist. And eventually, I just recently got diagnosed with bipolar disorder. So that itself has been very difficult to, you know, accept and come to terms with. So it's been very, you know, up and down, but I think therapy has helped and has had a big impact on how comfortable I am with talking about my mental health and also suicide as well.
Leslie, thank you for sharing with us your journey, and for sharing with us, frankly, your bravery and being so open and honest about your experience, because you're sharing your experience, I know, helps for a lot of people who will be seeing this, right? But also I know for a lot of people here on the call, it helps normalize the experience that many of us have, right? This doesn't need to be an isolating experience. So I thank you for being so bold in sharing your story. You mentioned in our interview for the newsletter, and you touched on this just a little bit, I think, by demonstrating it, how important transparency has become for you. You've mentioned in the newsletter the real value of transparency, both with yourself, being transparent with yourself and with your story, but also with others. So what does transparency with yourself look like? And what about transparency with others? What does that look like?
Transparency for me is very big just because, well, things weren't always discussed in my household, and it was very difficult, to come in terms with my own diagnosis, and just that itself was just extremely difficult. So I was like, oh, I need to be more transparent with myself and others. And being transparent with myself is just simply validating my own feelings and like being able to feel my emotions and telling myself that it's okay to feel this way, and have all of this going on, and just simply putting myself out there. And for transparency with others, it's just simply being very communicative with others and providing a safe space, and just pushing everybody else to like, be open, and that it's okay to, feel your feelings.
Yeah, that is a really empowering approach that you share. You're bearing witness to really what it looks like in recovery, in this mental health, mental wellness journey, to take an empowering approach, right? To validating yourself, right? That is a really profound step. To be able to just kind of acknowledge your own emotions without need of having somebody else acknowledge them for you, but also to encourage others, both by your example and by your words, to be transparent, to share your story. That's really empowering. Would you maybe share with us a little bit about, so you kind of touched on your experience with therapy and so on. So maybe diving a little bit more into that, how did you find recovery, if we can use that term, and what does recovery look like in your life?
Recovery was very difficult to go after. Growing up thinking, oh, well, there's no hope in many of the things around me. I just thought recovery would be something I would never do. I think reaching out, like outside my support group, was what helped me the most. Putting myself out there and then looking for therapists and just looking for therapy was very big, and simply just advocating for myself. I noticed that my depression eventually took over my life and destroyed many of the things I like typically enjoyed. And something very big for me was acceptance. So like just simply accepting that there's going to be hard days, and that recovery isn't just like one single process. It looks different. It varies per person. And that just simply affecting that life isn't perfect, and being okay with everything.
Yeah. What I'm hearing is that for you, this experience of recovery, I love the acceptance piece. It's not about like this kind of constant upward movement to like, okay, I had a rough time. I've had some really traumatic and difficult experiences, and now I'm just moving consistently upward. But it's really about a way of living your life and recognizing that there are going to be times, days, periods where you're feeling low, where things are hard, and accepting that as just part of the experience, as part of the journey, but also continuing to take steps towards, how should we say, maybe continuing to move forward. Is that fair?
Yes.
Yeah. So maybe a kind of follow-up question is, maybe two-part, is what are some ways that you ultimately have found hope? And maybe flipping that on its head a little bit, what are some ways that hope has found you, that hope has come to you?
I struggled to find hope just because I always knew that growing up, I hoped for so much things to happen and they never happened. So I was just like, oh, well, why hope if nothing, happens. But once I started healing and eventually putting myself, I realized that being hopeful isn't a bad thing. And it's just simply like something I want to do. One of my favorite quotes, it's like, oh, if you stay, the world will like eventually repay you. And that itself put me through a lot and has always like kept me hopeful.
That's great. Yeah. We just had Carolyn's presentation, and this wasn't one of the questions we originally talked about, so I apologize, I don't put you a little bit on the spot, but I don't think it'll be too bad. In Carolyn's presentation, we talked about highlighting some of the things that people are passionate about as a way of counteracting with hope some of these experiences that can lead to feelings of despair. What are some of those things for you? What are some things you're passionate about, or some of the things you really love doing?
Well, for me, it's just simply talking about my own experiences and
Mhm.
just providing that open space to everybody, just because I didn't have that growing up. So I think that was a big thing for me, just being open to anyone I meet and like allowing them to feel comfortable, to discuss anything.
Yeah, yeah. Really sharing your story. Really, it sounds like for you, this kind of taking your experience and letting others benefit from it, feel empowered by it, feel encouraged by it is a really important thing for you. Yeah. Thank you. As we kind of maybe wrapping up our conversation, is there anything else that you'd like to share or touch on for our group?
Yes.
Yeah.
One of my biggest things is just that I feel like it's often not talked about how generational trauma plays a big role in, mental health. My firsthand experience with suicide just wasn't with myself, but was with my mother instead. At the age of 7, I dealt with her own suicide attempt, which was very hard, and she never discussed it with me. We never talked about it, even though, I was like just there with her during it, and she never got the help she needed. She has bipolar as well, but she never got the help, and just because in her culture, it's just not something talked about, something you don't get help for, and it was just passed down from my grandparents as well. My grandma also had bipolar, and it's just she never got the help. So when it came to my own suicide attempt, well, all I saw was how my mom dealt with hers. So I never discussed it and just kept it to myself. And eventually, when I got older, I realized that not talking about it just made it even worse.
Mhm.
So I like reflected on that and reflected how much her experiences and how my grandparents' experience was like very difficult, and how much it's important for me, to break that cycle and eventually, discuss my experience and just simply be open about mental health. And I think that's something like important to just simply discuss.
Yes, thank you. That's huge. It's so insightful for you to recognize that a big part of what helps trauma perpetuate, right, from person to person, from family member to family member, from generation to generation, is being silent. We have this idea that sometimes if we don't talk about it, it'll go away, right? And it just doesn't work like that. And so you really are making such huge steps to break the cycle in your family. But I think also, I just want to encourage you that by sharing your story in this kind of environment and encouraging others, you're helping other people break the cycle in their families as well. Thank you. Leslie, I'm really happy to have you with us, and to share your story with us and your experience with us. Again, I know I've said it, I keep coming back to it, but it just is such a display of personal power and what empowerment can look like by sharing your story, both for you and believe me, for others as well. By you sharing your story, you're empowering others. So again, thank you. Thank you to all of our panelists. I want to encourage you all, it's always challenging with the time frame that we have. I know I say this every time. I feel like we could keep going for another hour. I'd love to continue to hear more from each of you and to give you all an opportunity to ask questions of our panelists. I want to invite you to share any questions that you may have. So all that to be said, we do have to manage our time, and unfortunately, we're running out of time for our panel. We decided to prefer as a team, in this case, giving you the opportunity to hear from Curt, from Carolyn, and from Leslie, with the hopeful possibility of a Q&A at the end, but we're out of time. So I want to invite you all to share any questions that you all have. You're more welcome to share them in the chat. You're more than welcome to email them to me or any other Partners for Wellness Connected OC staff member. I shared my email at the very beginning. I will share it again before I take off in the chat. But and you also will have my email if you received the agenda through our big email push earlier in the week. But any questions you have, please feel free to share them, and I will get them to the panelists and invite them to offer a response. and I'll try to send those out if there are any with our summary. So thank you all again for attending. We'll continue. We're not gonna conclude the meeting yet. We're gonna shift. I'm gonna hand the reins off to Sarah. But again, thank you, Curt, Carolyn, and Leslie for your time and for your presentations, your sharing, and your conversation. We will see you all. I will see you all because I have to take off in October, and I'll hand the reins off to Sarah. Thank you all.
Awesome. Thanks, David. That was an amazing discussion, and I'm so glad we were able to have the space to have that and be really honest with ourselves and just getting to hear from others' experiences. That's really awesome. And thank you, Leslie, for sharing. I know it can be difficult sometimes, but you're so brave for speaking up about it and raising awareness. And it's such an awesome story that you have. So we will start with Connect OC updates. What's going on with Connect OC? We are still in the planning stages of doing a resource fair at Cal State Fullerton. We are doing that October 25th. And we will be doing that on campus with a bunch of our partners. It'll be a really great time to get to reach out and hang out with students for a bit and just be on campus. We are also, me, Joy, and Vivi will be presenting at the AIM High event or series of events with Noble Path Foundation. We'll be doing that next Wednesday. So that will be really cool for us. And yeah, I will go ahead and bring it on to partner updates. So if you have an update that you want to share with everybody, just like raise your hand with like the little emoji thing and it'll pop up and I'll call on you. And if you have any flyers or anything that you want to send out, please email them to me. I put my email in the chat and I will share those with David, and I'll share those and he will share those with all of you as well when he sends out the agenda, the meeting agenda. So yeah, without further ado, if anybody has any updates that they want to share, please raise your hand. Oh, I see, Michelle. You can go ahead.
Hi, everyone. Thank you for all of what you're doing. It really takes all of us coming together as a collaborative force to combat this health crisis. Leslie, thank you so much for your courage and your openness in sharing your life story and what you've gone through. And I pray that you stay strong and find things that keep you joyful and happy with purpose in your life. And I just want to say to everyone at Just Gather, we're Digital Detox. We're working now with Anaheim YMCA, UCI Public Health, and we're trying to reach as many kids as we can to help them get some purpose and find themselves. And I'm becoming a gratitude practices expert, and I've learned how gratitude practices can actually alter perception through the premedial frontal cortex. You can actually reframe past trauma, like Leslie's experience at 7. We could maybe, learn how to find positives in everything that seems horrific at the moment, because that's when we grow. That's when we go through darkness, and that's where the light comes later. So I just wanted to offer us, we're new, but we're here and we're not giving up. We're all volunteers, actually 18 of us, and we're working a lot to help as many as we can during this epidemic. So thank you.
Thank you, Michelle. That was awesome.
Like, we're happy to support anything anyone else is doing. We could show up and do a 2-hour digital detox experiential or 5 hours and whatnot. So
Sweet.
thank you.
Thank you for that. I'll bring it up to the other Michelle.
Thank you. This is Michelle Nogales with Casa de la Familia. And again, Leslie, thank you for being so eloquent in you speaking about your struggle and your history. It's so relatable, I think, to so many. As I work for a nonprofit that specifically works with the marginalized community, Hispanic communities, low-income families, I would say about 80% of those we serve are Latino and are Spanish speaking. There are still so many stigmas within not only that culture, but many, right? So it's constant that what we offer is not just our counseling services, but it's advocacy to erase that stigma. You can't erase it perhaps altogether. So much can be generational, as Leslie pointed out as well, you know. But at the same time, we are here for the community. Historically, we've always helped victims of crime, but in the last 3 years, we had literally a 25% jump on people coming to us for depression, anxiety, suicidal ideation, and et cetera. So we know that this data that was presented today very much matches the data that we have also internally. We are here for the community for the past 25 years. We keep going. But one thing we've really started to do is not just, I want to talk about our community programs. Yes, of course, we have them, they're ongoing, but we're really trying to work now with policymakers, which that has to happen too, because we need to get that funding, not just our organization, but many nonprofits, so that we can all provide more programs for our youth, for the community. So the education starts at a much younger age, not just when everyone is 18, right? Or not just when they're in adulthood. But I do appreciate this particular forum, and it was just really well presented. Thank you, everyone.
Thank you, Michelle. I appreciate your input. I'm gonna go to Maggie. I saw your chat in the chat box, so you can go ahead.
Hi, everybody. My name is Maggie, and I'm here from the office of Congressman Lou Correa. I wanted to share a couple of things. We're going to be having a citizenship fair October the 15th, and it's by registration required. We have a flyer here that we have. We'll be sharing with you. I'll be sending that over. And then we also have another health enrollment fair for adults over 50 on October the 29th. So once again, this is all access to healthcare. And we are always in the know of healthcare issues here and wanting to be part of OC Connect to find out what's going on with the community. So thank you for inviting us, and we hope to see you at these events. Thank you.
Great. Thank you, Maggie. Yeah, send those over to me when you get a chance. That'd be great.
Sure.
Awesome. And then Kat.
Hi, everyone. Good morning. My name is Kat Reyes. I'm the new community engagement coordinator with Planned Parenthood. And I just wanted to say thank you to Leslie for sharing her story. I really appreciate you combating the cycles. And yeah, just want to commend you for sharing. You're helping a lot of people by sharing your story. Also, I also wanted to remind folks, speaking of education, as Michelle, or I believe it was Michelle who mentioned that education really does start at an earlier age, and the earlier we can talk to folks about different situations and different life skills, it could be very beneficial in the future. Planned Parenthood does offer different types of educational resources and workshops. I'll go ahead and send it over to Sarah to share through the email, but just a quick reminder that we do offer interactive, comprehensive presentations for folks to make healthy and informed decisions about their health. And we do have a peer program, peer education program that's happening in November 1st. I'll also go ahead and send Sarah that information to share with the group. And this peer program is a 4-hour session. It's 2 hours one week, 2 hours the next week for folks to learn about reproductive health in order for young folk to have the accurate information, be able to stay safe, and be able to have that knowledge to pass along to their peers, so this accurate information is spread and we can hopefully prevents any incidents, for example, of human trafficking, or even, for example, the continuous spread of STIs. So thank you so much, everyone, for your time today. I really appreciate these meetings and these spaces where we all get to learn from one another. Thank you.
Thanks, Kat. That's awesome. All right, I'll go to Chris.
Hi, my name is Chris. I'm the new college programs coordinator at NAMI Orange County. I'm really excited to be here. I am going to be at the Cal State Fullerton resource fair. And I used to live like right across the street. I've been on the campus like many times. Like I have friends that are students that go. I'm just like really excited to be there. And I've heard so much. I've worked like kind of behind the scenes with Connect OC. You probably have no idea who I am, and you shouldn't, but I'm really excited to be in this meeting. My supervisor Amanda invited me and I was like, yeah. And I just want to say thank you, Leslie, for sharing your story. It makes me so hopeful when I see people who are willing to be vulnerable, especially for a group of strangers, and turn their negative experience into a positive experience and use it to help others. So I commend you for that, and I thank you for that. And I'm sure a lot of us can relate to mental health issues. And it's nice for someone to speak up and advocate for us. So yeah, I want to say thank you for that. I dropped my I muted myself. I dropped my email in the chat. If anybody wants to connect and pull together resources, I love working with other organizations. So I just wanted to say that. Oh, and we do have a podcast over at NAMI OC for teens and young adults. We have happy hours, which is like little break times for students and young adults to kind of take a break from like midterms or whatever and come have some fun. So we got a lot of things going on, but I'm just really happy to be here, and thank you all for listening to me talk.
Thanks, Chris. We're excited to work with you too, and we can't wait to see you at Cal State Fullerton soon. Lauren.
Sorry, trying to unmute. Hi, good morning, everybody. I'm Lauren Gagos with the Wellness and Prevention Center. Thank you, Leslie, for sharing. We do have a mental health event tomorrow for teens and parents and our youth connected adults at Capistrano Valley High School from 9 to 12:30. It's our annual Together for Teens conference, and Partners for Wellness has been really amazing in helping create this event and get it set up. We've been working on it for quite some time, a lot of roadblocks with COVID last year, so we're really happy to finally have this in person. And we have Carolyn, who has been in this space before, sharing her story about her journey with an eating disorder and anxiety and depression as our keynote speaker. Some amazing breakout workshops for teens, including Uplift Yoga, doing a teen-led yoga session. We've got a music therapist, so just trying to make it really interactive. And then for adults, we have some wonderful workshops as well. So it'll be a great event. Please feel free to share it, or if you would like to come on down to South Orange County, we welcome you. It should be a beautiful day tomorrow. And then in addition to that, I wanted to share that on October 2nd, we are partnering with Be Well, part of the community suicide prevention initiative, to host a TAY suicide prevention event in Laguna Niguel. We will be building Find Your Anchor boxes and having a speaker talk about finding passions and how that just supports mental health and wellness. So I can share that flyer. And lastly, I just wanted to share on the topic of fentanyl and overdoses. The school district that we partner with, Capistrano Unified School District, passed last Wednesday to have Narcan in all of their schools. Wellness and Prevention Center is a distributor of Narcan, and so we're able to get Narcan 4 boxes into every high school, 2 boxes into every middle school, and 1 box into every elementary school by mid next week. So we're working on getting that out there. Hopefully they won't have to use it, but just to, a precaution in our schools. So that's just an update on that. Thank you.
Thanks, Lauren. Does anybody else have any announcements that they'd like to share with everyone else?
I just had a question about the Narcan when she said 4 boxes. Does she mean like cases or just 4 doses?
4 boxes, yeah, individual boxes. Each box has 2 doses. That's what the school district. Yep, exactly. Yep, that's what the school district requested.
Okay, I just feel like we need a little more though, in case, they have to administer it maybe 10 times till they get to the hospital.
Yeah, I
The
definitely
one-
agree.
Okay,
I definitely
okay,
agree
that's
with
all.
you.
Sorry.
Yeah, it's
Sorry,
the school
I've worked
district.
too much
is the-
lately.
Yeah, it's the school district, and we're working with them to encourage, to have more and for them to get their own approval to, be a distributor. So in the meantime, that's what they asked us to supply as soon as possible. But I definitely agree with you, Michelle, that they need more than 4 boxes in a high school.
Thank you. Thank you.
All right. Well, if we have no other announcements or anything, we can end a little early. Happy Friday. So yeah, if you need anything, please don't hesitate to email me. I just put my email in the chat one more time. So yeah, email me any flyers, any event details, links, all that good stuff. Yeah, so have a great weekend, everyone. I really appreciate your time and having you here. And thank you to our panelists and our presenters. It was amazing, such a great conversation to have. We really, really value your input and your expertise. So thank you, everyone. Again, have a great weekend, and we will talk soon.